Good morning. I'm Dr. Deuk. We are streaming live spine surgery from Deuk Spine Institute's operating rooms. Our patient comes to us after having a fusion at L5S1. You'll be able to see the metal plate. We did not do the fusion, it was done elsewhere. She has horrible back pain in her back and down into her legs. Turns out she's got sacroiliac joint pain on both sides and bilateral piriformis muscle syndrome. So she has 4 sources of pain. 2 are the SI joint, 2 are the piriformis muscles. Henry, do you mind showing our audience the 30 different causes of chronic back pain?
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. All right, welcome back. You can see from the video there are 30 common causes of back pain, and the sacroiliac joint that we're working on right now is the probably third or fourth most common. It really shares the position with the piriformis muscle. Can you show me further north? I think just a little bit. I think that's L5 up there. So never mind. Just stay where you are. Yeah. The first thing I have to do is get down to where these pain nerves are. You saw on our video how the procedure requires that we destroy 5 nerves that are pain nerves. And the first one is right here, right where I'm at. That should do it. Now I need to get myself out to the other nerves that are pain nerves. It's kind of where the tip of this probe is. But the problem for doing this procedure, the thing that makes it difficult, is that the ligament, the sacral ligaments, are calcified. They're very thick, and with age they become calcified and make it really hard to get past them down to where the pain nerves are. Right. Let's see, I need to do a little more, so I need another one. Any questions from our audience?
At this moment, no current questions.
Great. So basically, we're just using our probe, the Deuk Plasma wand, to get in and destroy 5 pain nerves to the sacroiliac joint. And I have to go through the ligament to get there. So we've been doing this procedure now for a few years. We've had some really good results. And hopefully it'll work for her. All right, let's go ahead and I think we're good. So we're done with the SI. Any questions?
At this moment, no current questions.
And you showed them how the SI is done, correct?
We have not. We showed the 30 causes of back pain.
Let's do that, and then we'll end the stream, and we'll come back with the piriformis.
Copy that.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK. 3496922.
And welcome back. I'm Dr. Deuk, and our patient has bilateral, means both sides, piriformis muscle syndrome. Piriformis muscle syndrome comes about when you have a tear through the belly of the piriformis muscle. The piriformis muscle is a small muscle located deep in the buttock. It runs from your tailbone, which has the name of sacrum. It runs from the sacrum all the way over and attaches to a bone over here on the hip called the greater trochanter. What happens is people bend over and twist, and that causes an injury to the muscle, the piriformis muscle, and that injury never ever heals. It just keeps getting aggravated every time the patient moves, gets out of bed, bends over, twists, walks, runs. Normal activities just keep tearing the muscle, aggravating the inflammation. Patients get pain and aching in their buttock, deep inside, and the sciatic nerve, which runs down your leg, passes right through that tear, and it gets irritated, so they get sciatic type symptoms. She has torn muscles on both sides. The best treatment in the world is to go in and do what's called the Deuk piriformis release. It's a patented treatment. It's done with a 4mm incision. You guys see how tiny that is? We're going to get started. We need to bring the fluoro in because we use x-ray guidance, and I'm going to basically cut the scar tissue and scarred muscle that's attached to the bone, and that's going to relax the muscle and allow it to heal. It also gets rid of the sciatic symptoms. So the first thing I have to do is get down to the greater trochanter, and that's something that you can actually feel with the tip of the probe. But you do have to use x-ray to find it. So hold on a second, shot. All right, to medial, I need to be more lateral. Once you get on that bone, usually you can feel it. I'm feeling something now, and it's very slippery in most cases. Very slippery. The greater, hold on. It's slipping off. I keep slipping off. Shot. That should be it right there. That looks great. We're on the back side of it. So I'm going to slip off to the front, and this is where the muscle attaches. Shot. All right, perfect. Let me see if I can get my holder out of the way so you guys can see. Shot. All right, show us the tip and show us where the muscle attaches there, Monica. There's the tip of my probe, and the bone, curved bone right there is where the muscle attaches. And again, it runs up to the sacrum. So this is a very, very painful muscle when it gets torn and injured like it is in this patient. And I'm going to go in and release this muscle so that it gets rid of the discomfort. Now she's had prior surgery. She's had a fusion in the past. We saw that earlier when we did her sacroiliac joint. Yeah, I can feel all the scar tissue around that piriformis muscle. Shot. Now there's the tip of the probe is about as high as you want to go when you're releasing the muscle. Huh? I'm good. I can feel it. All right, that should be it. Poor thing, was suffering for so long. She had a very small muscle. I can tell you that. There was not a lot of muscle to release. So she unfortunately is very atrophied, meaning that her muscles are very thin. Her gluteus muscles are very thin. She's deconditioned. She has not been doing well because she's had so much pain in her spine, and she had that fusion done, and that just made things worse. Now we just finished doing her sacroiliac joints. We did the Deuk plasma rhizotomy. She had a very calcified ligament in the back, made it very difficult to get in, but hopefully it works well. I'm going to go ahead and release the other side piriformis. Shot. Any questions?
Yes, we have a good amount of questions.
Shot.
First one coming from Henmeister on YouTube.
Is that it? Shot. Hold on. Let me see. You can actually see the muscle, guys, on that picture. I think right there. Shot. Yeah, I think that's good right there. Let's do that. We're going to make an incision. But show us the muscle there, Monica, before we get started. You guys can see a very faint. Oh yeah, so move your arrow. Yeah, right there. You were right there. Stop. That's it. That shadow right there. Yes, that's the piriformis, the top of it. And then the bottom part of the muscle, it's fan-shaped, is down a little lower, but my instrument's blocking it. But it attaches to the top of the greater trochanter. And for a long time, orthopedic surgeons would do this surgery open, with cutting your buttock open, filleting the muscle open. It's horrible, bloody, and dangerous. And I figured out we could do this very, very simply with a 4 millimeter minimally invasive procedure with no bleeding and no downtime. If you just go over to where the greater trochanter is, release the muscle there, and do it with radio frequency wanding. So that's what I've been doing, and it's been working amazingly well. All right, we'll take the questions.
Question from Henmeister on YouTube asking, just wanted to ask, what's the most complicated bits to fuse in the spine for scoliosis surgery? I'm getting T10 to L2 refused. Would this be complicated? My curve is 52 degrees. Is this operation near the glute muscle?
Yeah, so first of all, thanks for joining us. Thanks for asking your question. I would highly recommend that you, before you get your surgery, you do a consultation with me, because if it's pain that you're experiencing, I could probably get rid of your pain without major surgery. Now, you'll still have the curvature, and that will still be there, but at least I'll save you from a very highly invasive and dangerous surgery. Yes, fusion, osteotomy, laminectomy, and I did it very well. I've even published on it. If you look at my TLIF results, TLIF, on PubMed, you'll see that I published. My results were the very best, as a matter of fact, with pain during that procedure. My advice, do the free MRI review, see if you're a candidate for a less invasive treatment. It will not fix your curve, but it will get rid of your pain. That's my best advice. The hardest disc to fix is going to be, it just depends. The thoracic discs are difficult because you have a spinal cord up there, and if the surgeon accidentally damages your spinal cord, you're paralyzed. So the thoracic area is the riskiest area. But the L5-S1 disc is pretty difficult to get to because of the curvature and the iliac crest. I would highly recommend you avoid a major surgery like that if you can. I don't know all the details of your care, but I would like to learn. If you can just share your MRI and do a quick Zoom call, 10 minutes with me. All right, next question.
Next question coming from Scott on LinkedIn.
Hi, Scott. Thanks for joining us on LinkedIn.
Asking, what has to change in the health insurance model in order for better health outcomes to be realized? Surely the path that we are on with healthcare payers being on the stock market for financial gain can't be the way.
Scott, you are 1,000% correct. I couldn't agree with you more. What has to change? I could fix the system, but I need the power of Doge. I could meet with Elon, I could meet with Trump. I could tell you exactly how to fix America's healthcare system to get it back to the top of the world and one of the least expensive in the world. The problem is there's a tremendous amount of wasted money. Most of that wasted money goes to the insurance companies as profit, but they don't post it in their publicly traded stock profit. It's hidden because the publicly traded stock profit is regulated by our government and Obamacare federal law that it can only be 15%. It's called the medical loss ratio. And the insurance companies are only allowed to post 15% profit. So most of the profits are hidden, and they're hidden from the public. They're being diverted away through offshore accounts to companies that are called service companies to the insurance company. And we need the IRS auditors that have been auditing people for tax money. We need them to do an audit of the insurance companies and find that money and where it's been going. But I promise you, it's going to offshore accounts that are not visible to the government, and they're hidden from the government, and they're hidden from the stock owners. As a matter of fact, there's been a breach of fiduciary duty from the health insurance companies to the stockholders because they've been spending all this money on themselves, these very select few people. Now let's call it, there's an investment company that owns shares of United Healthcare, for example, and they determine that United Healthcare will have a service company that provides massages once a week for 10 employees. 10 employees get massages. You and I would say, well, that should be $100 an employee a week. So that's 10 times 100 is $1,000 a week, right? Times 52 weeks in a year. Well, instead of paying $100 an employee, this massage company gets $1 billion a year. Okay? But guess who owns it? It's owned by the special investor who has special, basically, access to profits of the health insurance company, and they were the original owners, the original power holders of the insurance company, maybe before it went public. And they make these side deals where all of your premium dollars are actually going into these service companies that are not regulated by the government, that are owned by private owners, that are the true power and control of the health insurance companies. Okay, so that's what's happening. And all it takes is a very, very detailed audit of their money that's coming in and how they're spending it to find this money and to stop it from bleeding out. So that's the first step that has to happen. The second step is the insurance companies should never be allowed to deny doctor-recommended treatment without having any type of, without having to answer to like a board that's made of people who are not financially controlled by the health insurance company. So when a doctor recommends a procedure like Deuk laser disc repair and the insurance company can just deny it now with impunity, they have no accountability. The insurance company has no accountability. So what we need to do is make them accountable for their denials. Right now, the Wall Street Journal just published an article last month on February 12th that there are 850 million denials done a year by the insurance companies. And so when you have 850 million denials of doctor-recommended treatment, that's bad, okay? Shouldn't happen. So the insurance company should not be able to deny doctor-recommended treatment at hospitals without having to go through a board review. And the board should be made up of civilians, regular people that are not controlled by the insurance company. So they don't answer to they're not beholden to the insurance company. That's how you solve the problem, okay? And then, of course, we get rid of the waste and fraud and abuse in healthcare by getting rid of procedures that don't work, okay? Not paying for them. I hope that answers your question.
We have one more question before wrapping up. Coming from Mixin on Up on YouTube. Asking, my dad is 3 weeks post-op after a 2-level fusion of the C-spine for cervical myelopathy. He has yet to see any difference in the symptoms, loss of feelings in hands, legs, and abdomen. Do you think he has any hopes of these symptoms clearing up to some degree?
Yes, I believe your father still has hope, but 2 weeks post-op is concerning to me. Typically, symptoms would be resolved or resolving completely by then, if I did the surgery. The real question is, did the surgeon do the right surgery? That's the real question. So we can't control whether a patient has an injury, like a neurological spinal cord injury, before the surgery. And all you can do as a surgeon is get to the problem quickly, do the right surgery quickly, and do the surgery properly. That's all you can do. And then that gives the patient the very best chance of making a full recovery. But some injuries, like to the spinal cord, could be permanent, and that could not, maybe it's not due to the surgeon doing bad surgery or not doing the surgery soon enough. Maybe it's just that the patient delayed getting medical care or didn't know they needed medical care. But what I see all the time is that there are delays in treatment that shouldn't happen, and that there is bad treatment being done. Even if you do a 2-level ACDF, maybe they didn't decompress the spinal cord. So the best thing you can do for your dad, if he doesn't make really good improvement, is get a new MRI and do the free MRI review with me. I'll be happy to look at his MRI and make comments once I've had a chance to look at whether the spinal cord and nerve roots have been adequately decompressed. Next question.
Next question, lastly, from Cassie, once on Facebook, asking, what is the difference between a traditional RFA and the Deuk plasma rhizotomy?
That's a great question. The traditional RFA puts a skinny little needle in one spot and leaves it there and prays and hopes that it burns the pain nerve and destroys the pain nerve, but it never works. The Deuk plasma rhizotomy, we use a wand to go around and we make sure we cut the pain nerve and destroy the pain nerve completely. It's just a much better procedure. It's the only way to be sure you're cutting and killing the pain nerves is with the Deuk plasma rhizotomy, and it's permanent, whereas rhizotomy is temporary at best. All right, thanks for joining us. We'll be back shortly with one more surgery.